Hello everyone, a very good morning. Today let's talk on another important 5-mark question or your short notes for your university exam. It is your hearing assessment and also it is important for your clinical practice. Yes. Coming to the hearing assessment, I have taken this topic from our IJPP article that was published on this April to June edition 2024. So, hearing impairment is one of the most crucial sensory impairment with significant social, educational and psychological implications. Yes, so failure to detect children with this hearing loss. So, failure to detect children with congenital or acquired hearing loss. So failure to detect these children with congenital or acquired hearing loss will result in lifelong defects in social and language acquisition. So this will result in defects or deficits in social, speech and language acquisition. This can lead to poor academic performance, and emotional difficulties. So you have to find these children as early as possible. That is, early identification of hearing loss and appropriate intervention should be done within 3 to 6 months of life. So this will demonstrate, this has been demonstrated to prevent many adverse consequences and it will facilitate a optimal language acquisition in the child. So they will be doing a newborn screening for every newborn irrespective of NICU care and irrespective of their mode of delivery, whether it is normal delivery or it is LSCS. Every newborn should undergo this screening, newborn hearing screening. This is done after the birth, before discharge from the hospital or before 1 month of age. And diagnosis of this hearing loss through your audiological and medical evaluation before 3 months of age and should be done. Diagnosis should be done before 3 months of age and intervention should be done before 6 months of age. Yes. So this is the hearing assessment or hearing test. So what are the screening tests that are being done? So screening tests that are being done at the time of or after the birth in every children. So screening tests are, I'll write the age here. So screening tests are done after birth. Sorry, mister. End of almost. Wait. So screening tests are done after birth, before discharge from the hospital or before 1 month of age. Diagnosis should be done within 3 months and intervention should be done before 6 months of age, right? So what are the screening tests that are being used? So screening tests that are being used are, first is OAE, that is auto-acoustic emission. Second one is your ABR. ABR is nothing but your auditory brainstem response. And third one is AABR. AABR is your automated auditory brainstem response. So what are the difference between OAE and ABR? We will see it here. So first is your OAE. It is your auto-acoustic emissions. So this autoacoustic emissions, it is used to assess the structural integrity and physiological measurements of response of the outer hair cells of the cochlea to your acoustic stimuli. So it is used to access the structural integrity and physiological and this is a physiological measurement of response of your outer hair cells of the cochlea to your acoustic stimuli, right? This is the principle behind your autoacoustic emissions. It is an objective screen test for a normal cochlear function. So when this OAE is done within 24 hours of life, this can be affected by your debris or fluid in the external and middle ear. So there will be a increase in the referral rates for the ABR. So when this OAE is done within 24 hours of birth, there will be a increase in the referral rate. Why? Because this OAE is affected by debris or your fluid in external or in the middle ear, right? Yes. This is regarding your OAE. Next is regarding your ABR. So ABR is your automated brainstem, auditory brainstem response. So it is your auditory brainstem response, right? This auditory brainstem response measures the electroencephalographic waves generated in response to the click via your electrodes placed onto the infant's scalp. So electrodes are being placed on the infant's scalp, right? And you are giving a stimuli. The stimuli is given as a click. Okay, and this when you give a stimuli, it measures the electroencephalographic waves. So it measures electroencephalographic waves that is generated in response to your this stimuli, right? Yes. Next, this is not affected by debris or your fluid in your external or your middle ear. This is an advantage compared to your OAE. Next, for this test to be performed, the baby should be very silent. That is, baby should be in a sleeping state, or you have to give some anesthesia to perform this procedure, right? So infant should be in a quiet state. Next, this assesses the function of your auditory pathway starting from 8th nerve through your auditory brainstem. So it is assesses the function of the auditory pathway. It is starting from your 8th nerve through the auditory brainstem. Okay. Next, so this is screening test. This OAE and ABR are screening test. So you have done a OAE for all the children or for the newborn, whoever is born at your hospital. After doing this OAE, if there is an abnormal OAE, then you go to or you refer the patient to this to do the ABR. So diagnostic ABR testing is recommended for any infant who does not pass your screening test. So who does not pass your screening test, then you do a diagnostic ABR. Next, this mainly OAE is OAE, this one, autoacoustic emission. This used to assess the outer, middle and inner ear portions of the auditory brainstem or auditory brain system, while your ABR, auditory brainstem response, it will assess from the periphery to the auditory nerve and your brainstem. It will assess from periphery to your auditory nerve and the brainstem. That is the difference between OAE and your ABR. So when you find a child with a normal OAE and an abnormal ABR. This means the child has a auditory neuropathy or auditory dyssynchrony. So if infant has this type, normal OAE and abnormal ABR, then you find the child to have a auditory neuropathy or auditory dyssynchrony. Okay. So this ABR and OAE are the test of structural integrity of your auditory pathway, and these are not the test of your hearing. Okay. So these both are used to test the structural integrity of your auditory pathway. Okay. Yes. Next. So beyond your OAE and your ABR, there are other tests. What are the other what are the other hearing assessment that has been found? So the other screening assessment are your ASSR. So what is this ASSR? Is your auditory steady state response. So this auditory steady state response, it measures, what does it measure? It measures the electrophysiological response to sounds from brainstem and your cortical. From brainstem and cortical pathways it measures. Here also you will keep an electrode placed on the child's head, and you give a stimuli, that is through the sound, to detect the electrophysiological response from the brainstem and your cortical pathways, right? Yes. For this also the child should remain still, or child should be quiet. So this auditory steady state response, it measures your electrophysiological response to sound from the brainstem, cortical path. Right? So this is your auditory steady state response. So we have read about your OAE, your ABR, and next is your ASSR, that is your auditory brainstem response. Next hearing assessment or next audiological test is your tympanometry. Tympanometry, it measures your middle ear function, that is for diagnosis of blue ear. So it measures the middle ear functions. Suppose if you want me to do in a detail of your tympanometry, just write it in the comment section for a detailed tympanometry topic, because if it is an important question for you, I will make it a tympanometry topic as a separate question. So this is the basic regarding your hearing assessment in a child. Your hearing assessment for newborn, it is mainly you have to know when will you do a hearing screening. So newborn screening is done after the birth or before discharge or within 1 month of age, and diagnosis should be done within 3 months of age, and your intervention should be done before 6 months. This should be done to prevent a speech and language deficit and your poor academic performance. All should be cleared off, or all should be prevented by doing this hearing assessment and your hearing screening and hearing diagnosis of your hearing impairment and your intervention. So what are the screening tests that is being done? One is your OAE, another one is your ABR. Next, so this is regarding your OAE and your ABR. What does it measures? When do you do a OAE, and what are the things that can affect OAE? Next is your ABR. For ABR, what does your ABR measure? It measures your electroencephalographic waves through the, when you give a stimuli to the child through a click. Yes. Next is your ASSR. ASSR is other than this, is beyond your neonatal screening. That is, this is not done as a neonatal screening. This is beyond your neonatal screening, I have told. Next is your tympanometry. Tympanometry used for your middle ear functions. This is regarding your hearing assessment. Yes, thank you so much for your patient listening. Let's all learn pediatric together. If you want any topic, just write it in the comment section or in our WhatsApp group. Right. Thank you so much.